Okay, let's talk about the MRI exam process. Everybody that goes into the MRI exam room must be screened and double-checked. TSA gate agents could learn a lot about screening people from MRI techs. Every tech, every doctor, every patient, every nurse, everything, everyone that goes into that MRI exam room must be screened and double-checked. That magnet is super powerful. It will lift cars. Yes, if you parked your Volkswagen near the MRI scan room, it would drag your Volkswagen across right up to the magnet. The MRI screening form. A screening form must be filled out and signed off on by the MRI tech before the patient goes in the exam room. For inpatients, the patient's nurse will complete the form if the patient is unable to do it themselves. Outpatients will do it when they check in. The screening form is a primary tool to make sure a patient with metal in their body does not enter the scan room and, of course, suffer an injury. Things made of metal you might not know are made of metal are nicotine patches, IUDs, and tattoo ink. If possible, these need to be removed before the patient has an MRI. If it cannot come out, the patient does not go in. That's pretty much how that works. So the MRI screening form has some interesting questions. It will ask if you've ever been a welder, for example. Welders will get little flecks of metal in their eyes and in their body, and when they walk into the MRI exam room, that metal will be sucked out of their body and go flying across the room like shrapnel and hit the MRI. And if it pulls metal out of their eye, it'll probably damage their eye to the point that they will be blind for life. So it will ask if you've ever worked as a welder. Modern tattoo ink doesn't contain a lot of metal, so just because you have a tattoo now doesn't mean you can't have an MRI. But older tattoos were created from inks that had metal bases to them, so if you had a tattoo in the 80s, you may not be able to have an MRI. What about techs, nurses, and PACS admins? There's no screening form for employees, but MR techs monitor and check everyone. Notice that's in capital, everyone, going into the exam room. If you have to go into the exam room, you'll have to empty your pockets in front of the MRI tech before they allow you in the room. In case you didn't already know this, the powerful magnetic field will erase the magnetic strip on the back of your debit credit card, and you'll have to get a new card. So it's another fun fact about MRIs. They will erase your credit cards. It's time to change clothes. Once the screening form has been reviewed with the patient, the MRI tech will have the patient change clothes. Clothes have buttons, snaps, zippers, rivets, all bad things in a magnetic field. The patient will put their clothes in a combination locker, put on a gown or scrubs. Then the MRI tech will walk them into the scan room and put them on the table. Finally, the MRI tech will position the appropriate coil for the scan on the patient, and there are many types of coils, such as surface coils, saddle coils, bird cage coils, all different types of coils. Like MRI, like CT, MRI uses protocols. With the patient in the magnet, the tech will select the scan protocol and do the scout image. From the scout, the tech will make any corrections to the scan program and then begin the scan. Once the scan is complete, the tech will check the raw images, and if they're good, they'll let the patient go. Finally, the tech can do any post-processing to put the study into its presentation state. And that is an overview of how the MRI exam process works. Thank you for watching.